Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D. Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D. Wilson.
This is Pamela D. Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey, to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, and coworkers to listen to the show. If you have a question or an idea for a future program, share your idea with me by commenting on my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. This week, we're talking about how to figure out what's wrong with aging parents when you notice small changes or suspect that something is going on with their health. If you're new to caregiving, you may have little or no experience working with the healthcare system. If so, you may not know how to work with medical offices or community health centers. It's possible that your elderly parents may have been healthy up until now. Or maybe they managed their doctor appointments. But now you suspect there's a lot more to the story than they're telling you, and you're concerned. During this program, we'll talk about how to open up conversations with aging parents so that they share information to help you figure out what's wrong and where you can help. Following this topic, we'll examine how limited experience can make it challenging to spot health problems or warning signs that can prevent health emergencies. And last, I'll share steps to take to prepare for doctor appointments, including a link to a patient tool that you can find on my website, PamelaDWilson.com, in the transcript for this week's episode, number 159. You can download and print a copy. And you can use this as a guideline to prepare for doctor appointments. But we'll talk more about that later. Let's begin with talking to parents about health concerns. Depending on your relationship with your parents, this may be an easy or difficult conversation. Parents may wonder why you are suddenly taking an interest in their health, which they may view as a personal issue that they don't feel comfortable sharing. On the other hand, aging parents may be delighted that you are taking an interest and want to help. But realize that as a caregiving spouse or an adult child, stepping into involvement with a loved one's help opens up a new door for ongoing work that can turn out to be way more than you imagine. This tipping point from being a husband, wife, daughter, or son to becoming a caregiver may seem like no big deal at first. If what's wrong with aging parents is easy to manage health problems or help with simple tasks around the home, this can go on for years until one day an accident, unexpected hospitalization, or a health diagnosis turns everything upside down. After that, life is filled with one event after another, nearly impossible to anticipate. One day, mom, dad, or a spouse is healthy, and the next, they're in the hospital. So, how do you know when a condition is severe enough to warrant a trip to the hospital emergency room for an aging parent. First, look for signs of sudden illness. They were fine 5 minutes ago. Now it looks like there's a problem. Or they went to bed last night, everything seemed okay. They woke up this morning and they really don't look very well. So here's some signs of sudden illness. It's a change in consciousness described by mental confusion, slurred speech, and inability to remember information. Difficulty with breathing, pain or pressure in the chest or stomach, or a really bad headache that doesn't go away. Obvious things are broken bones from falls, injuries, vomiting, blood in the urine, a severe burn, any type of bleeding, lightheadedness, or dizziness. If your parent has a condition like diabetes, one or more of these can happen frequently. In that event, giving any type of sugar like a candy bar or a soda can be helpful until you can figure out what to do next. As you learn more about your parents' health diagnosis, you will know how to identify conditions that can be managed at home versus those that require a visit to the doctor, an urgent care clinic, or a hospital emergency room. I always say if you're unsure, err on the side of caution and opt for the hospital emergency room. Attending medical appointments with parents and looking at their visit information in a medical health portal, often called an EHR, which is an electronic health record, can be a great learning experience for caregivers. Knowing how or if health information is shared electronically between doctors your parents see is essential to ensuring that you'll be able to coordinate their care. With this knowledge, you know whether it's your responsibility to make sure that an exchange of records happens, or whether when you go to that appointment, you can refer the doctor or the medical provider to the electronic health record when you attend those appointments with your loved ones. Trying to figure out what's wrong with aging parents can be accomplished by really getting a close look at their health records. For example, what is a parent's list of diagnoses? How long has this condition been going on? Is it stable? Has it worsened? Do mom take medications for every diagnosis that I see here? And a better question, have medications been recommended by their doctor but refused? Doctors can offer treatments, and patients have the right to decline. So as an advocate for a spouse or an aging parent, in trying to figure out what's wrong, it's good to know if a parent has refused medications, ongoing medical care, or any type of treatments. Aging parents or a spouse may refuse care for a number of reasons. Some might include financial concerns over being able to pay for prescription medications, medical tests, or other costs that are not covered by health insurance. Other reasons, which are more common, may include not having enough information about a diagnosis, fears, or personal values or beliefs or opinions about health in the healthcare system. When trying to figure out what's wrong with aging parents, good questions family caregivers can ask include, well, mom or dad, what do you want for your care? Do you understand you have these 5 diagnoses? And do you know what they mean? Do you know what the consequences are? And what's going to happen if you choose to do nothing about them? Now, this assumes that you as the caregiver have researched and spoken to the doctor and you know the answers to these questions so that when your parents respond, you can provide additional information. If you don't know, then these are the questions to write down and the conversations to have at the next doctor appointment so that the doctor can review each diagnosis, the background, the consequences, the risks, and the pros and cons of doing nothing. Another consideration when mom or dad refuses care is to ask, are they just tired, mentally exhausted, not feeling well, or is there any type of depression going on? Any one of these conditions can make it more challenging to follow along with the information presented by the doctor. For example, if you have an aging parent diagnosed with dementia or Alzheimer's, refusals commonly happen because your parent doesn't understand the information. They can't process it. And so it's easy just to say no, easy to refuse care. In these cases, if you are the medical power of attorney, the decision is yours to make, knowing, of course, what your parent would have done before this memory loss diagnosis, how they handled their care. There's also other reasons for refusing care. Sometimes aging parents may not want to be a burden to their children who work, especially if they need transportation to medical appointments. There's also the idea of autonomy. This is a word that you may hear used by health and legal practitioners. Autonomy means being able to make decisions about what a person does or does not want. Everyone has a right to decide how they live, where they live, what they do every day, and how they manage their health, as long as they can live independently and be self-sufficient. They have the right to determine situations, and although there's a point where this can become a little more complicated when things go wrong, when aging parents need help and the involvement of adult children who become their caregivers. As a caregiver, if a parent refuses care, it's a good idea to have a much deeper conversation about why. You may be more patient and understanding when you think about having this conversation as an opportunity to learn how a parent feels and what they think about their health. Because in a similar situation, you're probably going to want the same consideration. Here's how this conversation goes. Mom or Dad, you told me that X, whatever it is, medication, a treatment, seeing the doctor, isn't right for you. Help me understand what isn't right for you means. After you ask this question, you can only ask more questions and listen. Your goal, at least at this point, is not to offer more information or try to convince your parents to do something else. When you feel you understand the reasons for the refusal, it's best to repeat back to mom or dad what you heard, just so that you can be sure. Because sometimes it's very easy to misinterpret information. Then, if you understand fully and you have information that might be helpful, ask your parents if you can share the details. At this point, mom or dad will either continue to disagree or consider doing something differently. Regardless of the outcome, it's up to you as the caregiver to decide or to schedule the next steps. So let me use an example of a caregiver trying to encourage parents to complete medical and financial power of attorney documents, a living will, and a will. Parents refuse. The caregiver sees the effect of what might happen to their life and becomes filled with anxiety. In this case, what options exist? I'll share more about this after the break, and we'll talk more about how to figure out what's wrong with aging parents, specific to a process to attend medical appointments. Know that caregiving doesn't have to be a do-it-yourself job. My website, PamelaDWilson.com, offers help, support, and education for caregivers and aging adults that include online courses, articles, and more, plus over 150 episodes of this podcast, The Caring Generation, which answers questions caregivers ask. The podcast is available worldwide on my website and your favorite podcast and music apps like Apple, Spotify, Spreaker, and others. This is Pamela D. Wilson, caregiving expert and advocate on the caring generation. Stay with me. I'll be right back. This is Pamela D. Wilson, caregiving expert, advocate, and author on the caring generation. Check out my website, PamelaDWilson.com, where you will find my online caregiver course, my book, The Caregiving Trap, my caregiver blog, this podcast, and articles in my caregiver library. There's something for everyone on my website at PamelaDWilson.com. So before the break, we were talking about a caregiver, trying to encourage parents to take action, and the parents refusing. Now, when this happens, the caregiver is totally anxious, worried, freaked out about what is going to happen in the future if their parents don't do anything. So let's talk about the options. In healthcare, there is this concept called harm reduction that can actually expand into many parts of life. In healthcare, harm reduction usually applies to treating adults who have substance abuse problems who, for whatever reason, are unable or refuse to change their habits. You can also think of this harm reduction for people with diabetes or really anybody who refuses medical treatment. The process involves trying to figure out how to keep a person, your parents in this case, engaged or involved in discussions at a level acceptable to them, even though they refuse to participate or they refuse treatment. So as a caregiver, you're the person trying to help, who wants to keep aging parents involved in the conversation, although at this point, it's going nowhere. You can say, Mom or Dad, I understand that it's not important for you to complete legal documents, so that in the event of an emergency, I have the authority to carry out your wishes. So here's what I'm going to do. I'm going to take myself out of the middle between you and the doctors so that you can make your own choices. I'm happy to come visit, but I'm no longer going to be involved in your medical care, nor will I be your caregiver. If for any reason you change your mind and you decide you're going to complete these documents and you want me involved to help you make decisions or in a more supportive role, we can talk about it then. This conversation allows you as the caregiver to reduce the level of responsibility that you're probably feeling due to your parents refusing to make decisions about their care and not creating an emergency backup plan. Now, the goal here is not to threaten your parents with abandonment, but to be clear that you do have boundaries in this situation because there's a disagreement about what should happen. Your opinion is that it's better to be proactive to manage situations rather than responding to a crisis. So you're choosing, in a sense, not to be your parents' crisis management team who has to show up at the last minute and clean up a mess that you know is going to happen someday. While this may not be an ideal situation at all, at least it can reduce your anxiety. And you have let your parents know that you want them to make their own decisions and control their own lives. If or when something happens, your parents are still responsible for managing the consequences. You're not just going to swoop in and help and fix everything. In the meantime, you can maintain an arm's length relationship by suggesting that your parents work with their doctors to find any type of resources for the help and assistance that they need. So let's talk about attending doctor appointments. We've talked about autonomy, which is the right to make your own decisions and to be self-sufficient. The more that caregivers do for aging parents, the more aging parents expect. Now, this should be obvious, right? But when you're a caregiver, it is not obvious because all you want to do is be helpful. You want to make life easier on your parents, but what you don't realize is the more that you do, the less they do, and the less able they become to do things. Being overly helpful is a caregiving trap that adult children and spouses fail to consider until it's way too late and the caregiver feels overburdened. Let's think about the thought process of trying to figure out what's wrong with aging parents that eventually leads a caregiver to attending medical appointments. As individuals, our ability to solve problems or to figure out complicated situations is based on our personal life experience and what we've previously done. The same applies to an aging parent or a spouse we care for. Everybody has skill limitations, but what we do have is an unlimited ability to learn if we're interested. So the first area to think about is understanding how people look at events, information, and their relationships with other people based on personal beliefs and experiences. An example of this was my suggestion in the program's first half to ask a parent why something isn't for them and to listen without responding or judging or making suggestions. As a caregiver, if you disagree with something, ask yourself why. Why isn't this for you? Why do you disagree? This will help you get down to the nitty-gritty of why you think the way you do. Because the more you learn about your thought processes and decision-making abilities, the easier it will be for you to understand and evaluate information for determining what's wrong with aging parents. Do your emotions have a large impact on the decisions you make? Are you easily swayed by friends or peers to the degree that you'll change your opinion so that you have more in common with people in your social group, even though you really don't agree? Are you motivated to arrive at what you believe to be true? Or do you remain open-minded about evaluating both sides, pros and cons, and then making a decision? Solving challenges might become easier when you begin to pay attention to your thought processes and how emotions or interactions with peers affect your decision-making. When something happens in the future, instead of reacting automatically, you might stop yourself and take a different perspective that says, I used to automatically do this when this happened. I would get so emotional, so distraught, so angry. Instead, I'm not going to do that. I will think about this logically. I'll write down the pros and the cons. And even though I may ask my friends what they would do about this situation, I will make the best decision for me or my elderly parents or the person that I care for. Now, sometimes when making decisions, you might come to the conclusion that you don't have enough information, or maybe you're not quite understanding the information correctly, which leads you to asking more questions and more investigating, which is a good thing. All of these processes to gain insight into decision-making for care are valuable when you're really trying to figure out what's wrong with aging parents and you begin to work with the healthcare system doctors, nurses, other providers. In the show transcript for this episode, number 159, the way that you find it is you go to my website, PamelaDWilson.com, you click on the Media tab, then you click on the Caring Generation, and then all of the episodes are there. So this is episode 159. Go there and you can download a copy of the Society to Improve Diagnosis Patient Toolkit. It's a 5-page document that is very helpful, that you can complete it online or you can print it and handwrite it. It's a great resource for caregivers or yourself to attend a medical appointment. There's also resources in my online caregiver course. It's my resource called 5, 5, and 5 that you can look up. Both formats focus on preparing for medical appointments, identifying what's going on, so symptoms or pain, making sure that you document medications, herbs, vitamin supplements, why you're taking these, and then figuring out what's next after the doctor visit. So whatever process you use, whether it's this patient toolkit or you use my 555 appointment tips, use what works for you. Combine them, use them both. So with regard to this patient toolkit from the Society to Improve Health Diagnoses, you as the caregiver can complete the form. You can also help a spouse or an aging parent complete the form. The benefits of this and my 555 process are that you probably will get a better diagnosis because you will be more factual and more detailed about concerns, which is very helpful for doctors. This patient toolkit document also helps differentiate between you, your parent or spouse who needs care, and all the other people that doctors might be seeing who they think have similar conditions. And this can sometimes lead to a poor or a missed diagnosis. The Society to Improve Medical Diagnosis website, there's a lot of helpful information for consumers, and I'll make sure I put a link to the show's site in this transcript 159. But let's discuss a little more about preparing for an appointment. This is really the time to, if you have access, look through your parents' medical history. If not, talk to them. Have they had surgeries? Any type of major illnesses, and any type of past procedures that you should know about. You want to document information regarding past treatments, medications, medication changes, and then ask your parent, why are we going to the doctor? What is your top medical concern and the first thing that you want the doctor to help you with? Now, there could be 3 or 4 things or 5 things. You're not going to get all this done in one appointment. You might be lucky to get 1 or 2, and then you have to reschedule. But when you talk about your parents' concerns, ask them what they've done about this. So, were there prior medications prescribed? Did they have any treatments? Did any of this work or not work? In the patient toolkit, there is a worksheet, and it's called Symptoms of Pain. This is where you can write down what your parent is experiencing. Are they in pain, dizzy, not sleeping at night? Have they gained weight, lost weight? Do they have chest pains? What's going on every day? What makes the condition better or worse? And then the final page in this toolkit is what happens after the doctor's visit. So follow-up care, prescriptions, noticing changes in prescription medications, the effects, all of that. So this entire form of 5 pages makes it easy and gives you a process to prepare for the appointment, to share information with the doctor, and have a list of what to do next. Keeping this form on hand or printing multiple copies can help you create a timeline for the care that your parents receive. And it makes it really easy to go back and say, yeah, we saw the doctor on this date. This is what we talked about. This is what we agreed to do. Wow, we forgot to do this one thing. It's really a simple system that anybody can use. In my online caregiver program on my website, I'll put a link in the transcript, I also talk about the importance of having processes to manage health concerns, maintaining documentation for medical appointments, and creating ongoing routines to simplify care and managing care. Because family caregivers have so much happening in their lives all the time. It's easy to feel overwhelmed with everything that you have to do, and checklists and processes can be hugely helpful. Caregivers feeling overwhelmed. This often results from mental exhaustion and not knowing how to deal with all of these complex situations, trying to solve problems, but you're hitting roadblocks, or you have conflicts with family members or with your parents that just really run you down. Unfortunately, managing all these are not skills that we just routinely learn unless our daily job involves problem solving and working with other people and teamwork. Caregiving activities a lot of times are based on trial and error. What works and what doesn't work. You do more of what works and you do less of what doesn't work. While being a caregiver may be something that comes naturally to you, the skills to manage medical care and the financial and legal aspects can be a hurdle that you can learn. The best advice I can give is to find help early in helping parents by joining an on-site group or an online caregiver group. Also, ask for help from your doctor's office or the community health center where your parents receive their care. Find out if your parents' health insurance company or the community health center where they get their medical care has special programs for things like managing chronic diseases like heart disease, diabetes, arthritis, COPD, breathing problems, dementia, cancer, and other conditions. Learning to figure out what's wrong with aging parents and to coordinate care can be a process. Don't give up if you don't get it right the first time. Keep trying. As parents age, what you will learn is that one condition like heart disease can lead to diabetes, which then leads to kidney disease and other health complications. So as a caregiver, it's important, it's actually mandatory, that you make time to care for yourself to avoid these conditions. The knowledge and experience that you gain as a caregiver and through caring for others translates to wisdom that you can use to care for yourself and that you can also share with your children and other people in your family, plus your friends. So while trying to figure out what health issues exist for an aging parent, you can learn a whole long list of other things as a caregiver. Look at this as a learning opportunity, see it positively, see it as a journey, but know that it's okay to set boundaries if parents refuse to participate, because they do have the right to refuse care, as we all do. I thank you for continuing to post questions for this podcast and the videos I share on my YouTube channel. If you're looking for answers to caregiving and aging questions, visit my website, PamelaDWilson.com, where you'll find my caregiver education and resources. This is Pamela D. Wilson, family caregiving expert on the caring generation. This particular show on this date is in loving memory of my dear friend Kristen, who fought an amazing battle against cancer and died many years too soon. I look forward to being with you all again soon. God bless you all. Sending love to everyone. Sleep well tonight. Have a fabulous day tomorrow and enjoy each day until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.